goes there.
I love it. We're going live, so it's nice because you're adjusting it right around the time that we are. So it's perfect. I can see it fine. I'm going to give Facebook a chance to alert people that we are actually live. We're on here with them. Give us that thumbs up. Also, let me know if you can see Rudy's face mask. He made sure that he had his logo and everything showing. So if you could see that, we want to know, was his effort actually utilized or is it still hard to read? I'm going to give this a second. It also gives me a second to try and share it in a couple of different areas.
Well, I can't, and I'm blind.
Okay. Excellent. Blah, blah. Awesome. Okay, I have at least Counselor Seymour. It looks like Jolene as well is with us. So we're going to go ahead and get started. I know I was a couple minutes late hopping on anyway, so I don't want to take over the broadcast and not have enough time to share some of the amazing work that our nonprofit is doing. So to kick this off, you all should know me by now, Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and I welcome you back. And if you're new, then I encourage you to continue to come back. Make sure that you hit the like button, you hit the follow so you can get those notifications when we go live and post content. And also find us on all of our other platforms. We're on Twitter and Instagram at Westie Chamber and YouTube. I think most of you have memorized this spiel by now. If you've not, then I'll regurgitate it until it is just in the back of your mind. The video section of our Facebook page does hold a lot of videos that we've held since March. So since March, when COVID unfolded until today, we have those available to you at any point to watch them on replay. You guys are aware that we have started also featuring our nonprofits. Our nonprofits have also experienced changes or have been affected, whether it's positively or negatively, by COVID. And so what we started doing over the last 3 weeks is really shining the light on some of our partner nonprofits. And fortunately, most of them have carved out that 20-minute time block to be able to share about who they are, what they've done, and kind of what looks ahead for them into the future. And then to be able to answer any comments or questions that you have. So if you have comments or questions during this broadcast, please type them into the comment section of this broadcast. We'll pull it up for you at the very end and be able to address any questions that you might have or any comments and go from there. So today's broadcast is especially dear to me because I had the pleasure of meeting Rudy. We were just talking about this before we went live, I think nearly 2 years ago. It has flown by, and I've kind of been watching on the sideline what they've been doing and the work that they've been doing. And I was fortunately connected to them through Commissioner Tedesco, and all good things are connected to one another. So it's been a great relationship. I know they've done a lot of work during this time. And so their executive director, Rudy, is with us today to share a little bit more about Cervecias de la Raza and what they've been doing, things that they intend to keep, and then ways that maybe we can have some folks engaged. If you hop on, drop us a comment, give us the like. I see our board chair, Brian Dice, and Parker Brown are with us. Good morning and hello to you. Rudy, I'm going to mute myself and the floor is yours.
Well, thank you, Juliet, and hello, everybody. My name is Rudy Gonzalez. I'm the Executive Director for Servicios de la Raza, Services for the People. Our mission is to provide and advocate for culturally responsive, essential human services and opportunities. And what does that mean, especially during this pandemic? Servicios is a 48-year-old Latino-founded, still Latino-led, self-determinant nonprofit in the state of Colorado. And now I look around and I find ourselves as now the largest Latino nonprofit in the state of Colorado. And we are statewide now in scope and work. We stepped off statewide in April of 2018. We're probably the largest one-stop culturally responsive, linguistically specific human service provider in the state. And as that, we take that leadership mantle very seriously in terms of helping to provide nascent Latino nonprofits or coalitions or collectives that are doing good work in their communities, build capacity. while we are also engaged in building our own capacity to continue to grow, to continue to expand, to meet the need in our communities, the overwhelming need in a really diverse array of areas that include economic, political, social, and educational areas of our lives for Latinos here in the state of Colorado. And we have grown again. We have grown significantly. We have now approximately a $5 million budget. We have approximately right now we have active 49 FTE. We look to hire about 8 more under new funding that we were just fortunate to uh, be awarded and receive. And we are building again around capacity building. Our administrative work in the next 3 to 5 years is around fiscal management, is around human resources, and is around development, continued development. And so the pandemic hit, and we actually shut down to the public our facilities March 15th, and we reopened just this past June 15th after 90 days. And Servicios, what I really appreciate about our agency is that we are nimble and we are agile. And with that, we are able to pivot and bring in, we had an opportunity to bring in dollars to really build our IT infrastructure, our technology infrastructure. And so we put out a bilingual COVID operations flyer to our community within a week of shutting down. So people knew where to go, how to access us, and continue the services in reentry, in behavioral health with telehealth services, in victim services, in HIV STI services, in health enrollment engagement services, in health literacy and access and screenings and primary care services. In emergency services, we continue to be an essential organization. We continue to serve 200 to 300 a week on Wednesdays and Fridays with toiletries and food. And then we started and got dollars in, and we pivoted to deliveries, and we started identifying communities with targeting elder communities and immigrant refugee communities, and then even communities that had members who were COVID positive for sanitary product delivery for, again, food and toiletries. And so we are now serving at close to 300 to 500 a week in that. Deliveries to Commerce City, to Montbello, Westwood, Denver, Adams County, and other areas, Thornton. And so we are doing that almost full time in our emergency services. We even have a pet food pantry for our little four-legged beloved family members. And so we were able to create that and build capacity around that. So again, we have offices in downtown Denver. We are officed at the Mexican Consulate. We are their coordinator for their Window to Health program, Ventanilla de Salud. And we have a Mexican MD, MPH out of CU University, Dr. Ricardo Gonzalez Fisher, who coordinates and runs that program. We've been testing COVID free over there, COVID testing over there for free. And you don't have to experience symptoms. And we've been doing that daily with our Mexican immigrant community, and also other communities, our Asian immigrant community, our African immigrant communities, through our partner CAHEP, which is the Colorado Association of Health Equity program that's run by Dr. Alok. Their primary care clinic is right across the parking lot from the consulate. They're on South Leetsdale Drive. And so we're doing a big COVID testing event this Saturday. And we're doing, in conjunction with the city of Denver here at Servicios, next Thursday, another big COVID testing event with food and toiletry and sanitary products distribution. We're getting ready for August 7th. We have 500 backpacks. We know that schools are going to be working online, and I'm so happy to know that, because I don't think our kids should be used as guinea pigs in this pandemic, and I'm happy. But our children still need that help and still need those supplies. So we'll be doing that. Also, Servicios has started a new program with FEMA funding through the CARES Act and CDPHE, the Colorado Department of Public Health and Environment. We will be pivoting to provide more mobile mental health first aid with 5 mental health first aid mobile counselors that are going to be going into our communities and working with our communities in a culturally responsive, linguistically specific manner to help in this pandemic and provide people, help them to acquire hopefully more stability and a peace of mind. We are in a highly stressful time. I'm also been appointed and been serving as a governor appointee to the Health Equity Response Team with 25 other people of color across the state of Colorado. And we have helped the governor to articulate 3 issues around economic security. And I think that plays right into line with the Westminster Chamber of Commerce, that messaging and testing and tracing in our communities. The messaging has got to get better, especially with Spanish speakers, and the nuanced, and it has to get more consistent across between municipality, county, and local and state government, correct? And so I've been doing that work. We also advocate, many of our staff serve on boards and councils, commissions, task force, and bringing our incredible subject area expertise to areas of policy and legislation and those kinds of items that kind of deconstruct systems that aren't working and reconstruct systems. We do that work too. And, that work's not resourced. That is our commitment and our dedication and our love for the work that we do and for our communities, and our love for what's called what I consider is justice, equity, and peace in our communities. And the fact that this pandemic has exposed, which have always been there, but it's exposed stark disparities in our communities. And it is, I think it's good in that way. That is maybe one of the silver linings here, because now we can really clearly bring clarity to that definition of what those disparities are, and also be able to be at the table of our electeds and appointeds in recreating and coming back, because I don't want to go back to the old normal. The old normal wasn't working for our communities. We need to create a new normal, and that is, again, economic equity. That is social equity, educational equity. And so that's what Servicios de la Raza is about. That's what we are about as a nonprofit. I see a lot of service providers, but if you're just serving the problem and you're not addressing the root issues and the systemic issues, then you're only doing half your job. So, we have to be fearless in that way. And we are. And, and I hope it helps to bring more resources so we can do more with our communities and impact at a higher degree and create more positive and healthier outcomes as a result.
Thank you for that, Rudy. I know we've had several people that have that have hopped on. Counselor Scully, it looks, has also tuned in with us. She's sharing a good morning message. It looks like Jason Ganal is also on here, Regina English, and several others. Please be sure that you give us any comments or questions into the comment section of this broadcast. We have with us Rudy, who is the executive director of our amazing nonprofit that's Latino-based, Latino-led, but services a variety of our minority communities across the state of Colorado. And Oh my gosh, you just went through a number of things and I was trying to frantically type them out because I knew that you had so much going on. And so I was breaking them up into nuggets as much as possible. You know me, and I will go back on every one of these and probably ask you a couple of questions here and there. First of all, congratulations on being appointed to the Governor's Health Equity Board. I think it is crucial that it is surrounded with representatives of all members of our community, and I could not think of anyone better to be there representing us. So that is exciting. That's amazing news. And it looks like you also touched on, we shared your budget. You shared the growth that you're experiencing in terms of FTE. And then you also touched on the passion. And I think that's one thing, I always say this whenever we have our nonprofits, but this could not be any more true for nonprofits like ours, where we start and it's, it's a little bit there and you have this vision and idea and you need the buy-in. And to get where you have gotten is a clear indication that you are providing that result and you are making an impact. So to that end, we talked a little bit offline about the reintegration of individuals back into the community, and you shared with me a statistic that I'm incredibly proud of. So can you share this with folks, kind of expound on that program that you have, how you all have successfully been doing this, and then show the stark contrast between the folks that you're able to help in comparison to the ones that do not necessarily go through you all?
Thank you, Judy. Sure. And just a little kind of foundational knowledge is Servicios, we're a very complex nonprofit in that we have so many programs, and unfortunately, funders don't fund like general operating support, that umbrellas all of our programming. So we have a lot of siloed funding. We have over 40 grants that are state, municipal, judicial district, philanthropic funding with multiple different reporting dates, fiscal year dates, and it's complex, and we're always working very hard to stay abreast of everything. And with that, the money silos. So we have a reentry program where we work to reintegrate what I don't like to call them ex-offenders, I call them citizens back into our communities. And to reintegrate them successfully back into our communities. So we have 3 different funded reentry programs with 3 distinct populations. We are funded by the Colorado Department of Corrections, and we are the #1 community reentry program for them out of 17 statewide community reentry programs. We've had this funding since 2015, and it has grown from $150,000 a year to this year was $660,000 in funding because of the work we do. I really appreciate a funder who rewards good performance, that's another systemic issue that needs to change around funding equity. Then we're funded by the city and county of Denver. We run all of their reentry for both the city and county jails of Denver. And then we're funded by the Department of Labor and funding to do reentry for youth, young adults, 18 to 24, who could have any involvement with criminal justice, who could have been at 13 walking, getting a jaywalking ticket. We can help them with job placement, with supportive services, with case management to get their lives back on track and to do well, and not fall back into the criminal justice system. My father used to call, we talk about recidivism. That is the kind of be all end all. I mean, you have different elements of success, like job placement, like retention, like licensing certifications and stuff that, you can gauge success with reentry. But the be all end all is called recidivism. It means when my dad used to call it doing life on the installment plan, or the revolving door of the criminal justice system, that people go out only to go back, that people get their freedom only to go back, reoffend, revocate for technical violations, whatever. Recidivism is that word, that people who come out then unfortunately go back to prison and again do life on the installment plan. Well, our recidivism on our 5 years of work with the Colorado Department of Corrections, and I worked for the Department of Colorado Corrections, and a good year for them is 50%, which means half of their population that are put out on parole are going back to prison for one reason or another. And a bad year is 75%. Our recidivism rate, with over 820 clients served here in the Denver metro area from all the prisons across the state, because we go into all the prisons across the state to present and work with our clients to get them ready to come and reintegrate. Our recidivism rate is 2.08%. And, you know, if there was a Hall of Fame for recidivism, we'd be in it, because that's amazing. That is an amazing. Everybody who knows this type of work, especially our state DOC, Department of Corrections, Dean Williams, who's the executive director of that, are just can't believe the success that we have. And it's because we hire incredible staff who, again, are culturally responsive. When I say culturally responsive, I'm not talking about just ethnic or linguistic culture, but it's a culture of the streets, the culture of prisons, the culture of poverty, the culture of foster care, the culture of aging in place. It is multiple cultures. Culture is living and breathing. It is an entity. It's a living and breathing entity. You can't be competent in the culture because it evolves minute by minute. And so, but we can be responsive. And so that's what it's about. It's about relevance. It's about responsiveness. It's about respect. It's about rigor. It's about setting the bar and getting our clients to not only engage but achieve. And you know, and it's about that dignity of working with people. And so, in just the city and county of Denver, in 26 months we've had this grant. We have cut the recidivism from 66% to 30%. So it's amazing. Yeah. And we worked with over 4,000 clients there.
That's huge.
In the city. So, you know, we need Adams County to step up and saying they need a reentry program that we need to be able to develop with our Adams County commissioners to handle reentry in Adams County in a successful, really concentrated, exclusive way for Adams County and Broomfield, right?
Yeah. Well, and thank you for touching on oh, I hear a little bit of feedback for myself. So thank you for touching on that, because I was going to ask you, you know, what one thing would you need some assistance on? And so you kind of touched that by sharing about those two other counties that you hope to expand in. And I loved your definition of the idea of culture, that it is past what most people try and identify it with. And it speaks to why you have such a variety of services that you offer, because it's not just one approach that's needed to provide that support to all of your clients. It is numerous things that impact their lives, and to help them move forward, you need to make sure that you're servicing as much of those needs as possible. I thought the pet pantry was too funny. Are you taking donations for those, or how is that generally?
We do take donations consistently. You can donate online at our website, or you can write a check and send it to 3131 West 14th Avenue, Denver, Colorado 80204. And, you know, Servicios de la Raza or Services for the People, that's fine. You know, you can make food donations and bring them to our emergency service program here at the same address, 3131 West 14th Avenue, Denver, Colorado 80204. Or you can call and find out how you can donate to 303-458-5851 and talk to our incredible receptionist, Diana Lopez, who's an Adams County resident. She comes out of
Yeah, that's awesome. Thank you so much. You are on this. You're like, you and I, this is why we connected earlier on. We're not bashful about asking when we need that support. So for information on how to donate, if you intend on donating through checks or monetary support, your address has been included into the comment section of this broadcast. I've also included the phone number if you have specific questions about any of the programs that we touch on. There are quite a bit of those. Did I spell that right? Did I do that right?
Yeah. And also for volunteer, if you want to volunteer in
yes.
Pantry, and we do abide and adhere to strict CDC, CDPHE protocol. So we're open, but we're very cautious. We're very safe around. We have what we learned during the pandemic is how to work robustly, virtually and remotely. So we are able to keep only half of our staff in the building, and that's in all our offices. If we have multiple staff, we're kind of staggering them, right, with throughout the week. And I'm the only one that has to come in every day.
Well, and I imagine that you choose to come in every day.
Yeah, our air conditioning works, so I'm happy.
Yeah, it is your dedication to it. We have a few more minutes, so if you're okay with me kind of going through some of this stuff, I just want to make sure that we touch on it in as much detail as possible. This Saturday and next Thursday, you mentioned a big event that's for testing as well as distribution. Are you seeing that it's hard to reach any type of members in the community that you might need support with getting the word out to them? I know very early on when we did talk with Adams County, they had talked about the free testing options that were out there, but it was so underutilized whenever they gave some of those numbers. And I'm not sure, are you experiencing that with some of these efforts that you're doing? Is there a way that we can help spread the word about those?
Sure. What we'll do, Juliet, is go ahead and send you all of our information and our media. And you can also go to our website. And through our website, please click on our Facebook link, because our Facebook page is very robust. We put out a lot of material daily on it. We are followed by almost 9,000 fans now, and we have an outreach. We have an engaged outreach of, and without boosting our posts, we have an outreach of 15 to 20,000 and an engagement of 25 to 30. When we boost, it goes to 50,000 engagement. So we are a very robust Facebook page. If you maybe go to it daily, you can see or really know what's going on at Servicios. Also, we do a lot of humor and a lot of cultural stuff and a lot of history and things you didn't know about our community, right? And about our history in this country and across the globe. And
I think that's terrific. No, I think that's awesome. So I've included that. Make sure that you follow them. I'm going to find your Facebook page and actually put it in the section so that they can access that as well and see more of the real-time information that you all are sharing and some of the work that you're doing, because people should know about this and be talking about it. I'm always blown away.
And you're going to like it, right, Juliet? You're going to like it.
I'm going to like it. Of course I am. We talked about this right before we hopped on. We're going to remedy the fact that I haven't seen you for as long as I haven't. So that will get fixed today.
Yes, I need that to happen presently. Yes, remedy is a good word.
Yes, we will make that happen. We're so good about fixing things, right? Let's fix this.
That's right.
Well, for anyone that's hopped on a little bit later in the broadcast, we have Rudy with us. He has shared the extensive work that they have done. I've typed in as much of that in comments into this comment section of the broadcast. However, it is best for you to rewind and make sure that you have a pen and paper, because there is a wealth of information in this broadcast. If you are connected to communities that would benefit from the work that Rudy and his team does, please make sure that you share this broadcast with them. Let them know of the programs that are available, because the best way and the best form of marketing has and continues to be word of mouth. And so let's grow that and grow the impact that he is already making and build on that success that he has. If you think of any comments or questions later on and you hadn't had a chance to ask it during this broadcast, type them in or DM us. I'll be sure to send an email to Rudy and share, here's the comments that I've received. If we can get some sort of a reply to them, we'll do that as well.
I'm remiss. I mean, we're talking Adams County, and we have Juliana Ramirez, one of our community navigation specialists that spends 20 hours a week at the Pete Morales building as part of the nonprofits there. So on 20th and Pecos, you can go talk to Juliana. She can get you hooked up with services. And again, you can contact her through the main number, 303-458-5851.
No, don't you want Rudy on your team as like the more that he's like plugging in things, he's like, this is where you go, this is what you do. You're like, ooh, how can I just, hold on to you forever. So type that into the comment section. It's 120th and Pecos. Talk to Lania and she'll be able to help you access that information. Same phone number, we've included that as well. Give us the hashtag replay. Let us know you've tuned in, if you've enjoyed watching. Rudy, don't go anywhere once we end the broadcast. But for those of you that are still with us until this very end, know that we will be back here tomorrow at 11 a.m. Tomorrow, we are rounding out the week with Highland Hills Parks and Recreational District, what they have had to experience during this time, which facilities of theirs have had to close, what their projected dates might be. So bring those comments and questions. As you all are aware, Highland Hills does service a variety of different communities around the area, not just Westminster, but Federal Heights and numerous other ones in our immediate area. So if you have questions about Highland Hills, bring them then. If you have questions for Rudy that you didn't get a chance to ask, type them into the comment section. And if you're interested in engaging further with them, be sure that you drop by, send them a check, or call them and follow them on their social media platforms. Thank you so much for everybody that's tuned in, and to you, Rudy, as well, for sharing as much as you could in such a short period of time. If I could and could keep you for an hour, I would have. So thank you.
Thank you, Julia. Thank you all.